Representative Williams sends his regrets that he couldn't be here today. It's been a very busy week with things stacked up all over the place. And as Nick mentioned, I am, of course, not Representative Williams. He is much more handsome and much better dressed on pretty much every day. So anyway, Representative, this is something that Representative Williams and I talk about quite a bit. We'd actually been discussing even before the recent hospital closures, and we're fortunate to work with Vanessa on this program and just in general in getting information from the community about what's needed. And of course, it's, you know, we certainly need the hospital, right? We certainly need an emergency department closer. And quite frankly, maybe more services than Brandywine offered at the end, right? We certainly need a behavioral health center for the county. So, but even long before that, there are issues right here in Coatesville in the area that we were looking at, right? There's not many doctors in the area. There's urgent cares close to Coatesville, but none in the area. So even with that and the hospital itself, transportation is one of these issues. It's not just the hospital or even specifically healthcare itself, but providing access to healthcare, making sure people are aware of and know how to navigate the penny system, which is, for those of you who don't know, that's Pennsylvania's own version of ACA or Obamacare, which is Pennsylvania took it over themselves, which is a great program even compared to other states. So, you know, we try to engage the constituents when people call us with issues. We try to help them get into that program. So I just wanted to bring that up first. And there's some other, we have some questions I wanted to go over real quick. The first one is the effort that the state is making that we can share from Representative Williams' office. The budget's right around the corner. It's an annual mess. You know, of course, Representative Williams is pushing for even more money for the penny program and everything in human services, even in education, a lot of things that touch on health care. But specifically, he and Representatives Howard and Schusterman from other parts of Chester County are introducing legislation that's based on the closing of Brandywine and Jennersville hospitals, but should apply for the rest of the state. This hasn't been introduced yet. I believe we're looking for one signature on it still, but it already has about 27 or 28 co-sponsors. For those of you who don't know, a similar thing is happening over in Delaware County with Crozier Hospital. Okay, so and has happened in Philadelphia, and inevitably it's going to happen around the state. What this legislation would do is it would require approval from the Pennsylvania Department of Health before any hospital or hospital system can be purchased. So in other words, the state would be involved in this transaction. Part of it would be that you can't close without having somebody to move in, right? Or proving that that's not necessary in your area, right? The state would not get involved in who purchases, purchase prices, or anything like that. But you have to cover the area that you've agreed to cover in the first place. And if not, there may be implications for the rest of your hospital network. And, well, I kind of hate to pick on Tower Health, but not too much. So, for instance, in a case, and now this isn't in place now, but in a case with Brandywine and Jennersville, okay, you close here, you might be looking at an impact to what happens at Reading Hospital, right? So it has a little teeth to it. The DOH would review applications, also hold public hearings, and prepare impact statements and help line things up for the public when a private business like a hospital changes hands. It would also require price transparency from any hospital or hospital systems, not just on that sale, but in any services they provide, right? We've all heard about the $30 aspirin you get when you're in the hospital, right? Well, you have to provide the cost now and say, yeah, we only pay 16 cents a piece for these, but we're charging $30. And, you know, can't force them to say, oh, no, you're only going to sell it for 25 cents if you buy it for 16. But at least provide that information, make it transparent so the public understands and has the option to say, you're only paying this much, why are you charging me this much? So that's the gist of that bill. Like I said, it should be introduced next week when they go back to session and get a bill number on it. So the next thing I have here is the formation of allyships and discussions at the state level around this issue for Chester County, so we don't face another closure. Well, look, quite frankly, from the legislative perspective, this is the best thing we can do, right? Get people that are professionals that are out there on behalf of the public involved in the process. In this case, that would be the Department of Health, and I would assume that the Chester County Health Department we get involved also, but we can't legislate on that one, unfortunately. But a lot of it is just working with all the players, and it's not just the hospital companies or owners, right? In our office, and Representative Williams, we deal a lot with different provider groups, okay? And that's not just the healthcare groups. That's not just the administrators at the hospitals, right? But groups of nurses and the nurses union, groups of doctors, private practices, who all want to see the same thing. And look, these people have to pay their bills, and you know, I still think it's supposed to be a pretty good paying job to be a doctor. And you've all heard about all the headaches with student loans. Imagine after that much schooling, what you're looking at, right? So we're not saying we need to cut them out, but we want to keep them in the discussion. Also, those healthcare providers that I mentioned, health insurance companies, right, who are involved in our process, even if you're on Penny, right? You have that public-private, essentially, coordination. And also community input. That's really, from Representative Williams' perspective, that is the most important part, and what's so great about the meetings we've been having for the past couple months is we certainly need a hospital. We need an emergency room. We need a behavioral health center. Everybody knows that. But what do the people of Coatesville need, right? What do the elderly residents up at Freedom Village who moved in close to a hospital need? Or even a better example is Jenner's Pond. I don't know if you're all familiar with the area, but there are at least 5 or 6 large 55-plus communities, plus Jenner's Pond, right? Plus Ware and Oxford, right? And a couple other facilities around there. And the only reason they chose that location is they were so close to the emergency department, which is now gone, right? So what are these people looking for a replacement that comes in there? Or what other types of facilities may be able to take care of their needs, right? And it's, in some cases, it's going to be an urgent care, but in a lot of cases, it's not, you know? And how do we promote businesses coming in, be it in urgent care or even just a simple family doctor's office, right, to provide that care. So those are the kind of things that we're working on a regular basis. So it's not just the legislation, but that is a big part of it. But Representative Williams is very aware of his responsibility to help the community outside of passing legislation and make sure that people can get a senior SEPTA card or all the other stuff, help with their employment. Right? There's more to it than that, and that's the way we try to look at it every day.
Great. Thank you, Bill.